Welcome to Conversations Different, where we focus on interesting people and places in northern New Mexico. This is Inez Russell Gomez, and today we are talking to Mark McDonald, Executive Director of Villa Therese Catholic Clinic, dedicated to bringing medical care to people who are underinsured or uninsured. Welcome, Mark.
Thank you so much for having me. I'm so excited to be here.
Good. So you're finishing your first year running Villa Therese. How has that been, especially considering patient numbers are skyrocketing?
Yeah, absolutely. So June 18th was my 1 year anniversary here. I was hired last year. It has been an incredible year of growth. When I came on to Villa Therese, of course, we were still recovering from the COVID pandemic. We had some staffing changes. I came into a vacant executive director seat that had been vacant for several months. And so we had a lot of work to do. We focused on staffing to make sure that we have qualified and dedicated staff who understand the mission. Our board of directors really did a great job of filling, the gaps while we had the absence of an executive director. So it was kind of easy to pick up the pieces, but we had a lot of work to do. We knew that we could make more of an impact, that there were more patients that we could see and serve. And we've made it our mission every day to do that. And as you said, patient numbers are skyrocketing. There's multiple factors contributing to that. We're really happy with the way that we've expanded services. So we've taken a look at how we can make a bigger impact for our patients and how we treat them, both medical, dental, and vision. And it's been an incredible year. It's been a very busy year, but it's been an incredible year.
Now, I can imagine. I was thinking back to my own interactions with Beatrice over the years and reporting, because I used to cover health. And it used to be by the Cathedral Basilica. I could just walk over to talk to the people at the clinic. And then a few years ago, there was a decision to move it away from an old tiny building that was hard to get to the Hopewell Street area, where a lot of low-income people live, so they could probably walk to get care. How did that, it was before your time, but talk about that decision to go where the need was.
Yeah, that was an incredible decision that was made by the leadership at the time and something we're so grateful for. Of course, we're in a brand new building, which serves our staff great because we're able to do more things. But more importantly, it does reach more patients. We're in the Hopewell Man District, and it is an area that is in significant need, and a good volume of our patients come from this district. And so it speaks to the idea that if we offer a service, that's wonderful, but how do people access that service? And so even moving closer, we still find that a lot of patients throughout the city, both in this district and further out, they still have difficulty figuring out how to get to our services. And so it was an incredible decision. It was an incredible move. It certainly has helped amplify our message and our services. We're definitely making a bigger impact, but we've recognized that transportation to us and home is still a big issue.
Right. I like how on your website you say we're 3 blocks from the number 5 bus stop. So you let
Yeah.
people know there's a way to get here, even if you don't have a car or a truck.
Exactly. Yes. Yeah, correct.
Yeah. And even though Beatrice was founded in 1937, it seems like a lot of people still don't know that it's here. And it's also incredibly unique in the sense that it's a free clinic.
Absolutely. So I want to touch on that last point that you just made. We're New Mexico's only completely free clinic. So we don't charge any of our clients for any of the services that we provide. We don't bill Medicare, Medicaid. We don't take federal grants. We're supported 100% by private grants and private donations. So that does set us apart because so many more people in this time are feeling displaced in the healthcare system. And that's a trend that we've seen for a long time. I've been in healthcare in New Mexico my entire career, and it's something that I've noticed. And it's not just rural populations. Urban populations are feeling displaced more and more every day as well. And as as far as making sure that we have the access issue covered, that is super important to us. And it was founded a long time ago. The mission has changed, but it's kept consistent with providing those services to the people who need it the most.
Right. And it's not just medical care. As you said a little earlier, it's dental, eye, vision, and vision is really important because if you can't see, you can't get around to conduct your life.
Absolutely. Vision is one of our busiest clinics, and it is so incredible to hear patient stories and testimonies every day when we have a vision clinic. I didn't realize how bad I could see. I didn't realize how much this was affecting my life. Access to dental care and vision care is a step above the difficulty, that it is to access regular medical care, and they're
Yes.
both such a vital important part of someone's health. And so you're absolutely right. You know what was interesting, we did an eye clinic for international artists at the International Folk Art Market last year,
Right.
at their conference, and we're doing that again this year. And it was incredible to see people from around the world uh, tell us, I didn't realize how much better I could see my stitching and my art after this eye exam and glasses. And we often think and place that problem on places that are distant from us, right? We like to pretend that it's an issue that is foreign to us. But come spend a day in my clinic. You'll see the same thing with your neighbors, your friends, your family. They're facing the same thing. And access to that care is getting harder. And so our services are addressing that need in an important way. And it's incredible to watch the impact.
No, I was reading in your biography that you had worked on the border and were in Mexico doing clinics and healthcare. And I was thinking, you come back to your home state, you're in the richest country in the world, and basic services aren't available for everyone who needs it.
It's incredible. I started my career as in healthcare as a paramedic. I went to University of New Mexico EMS Academy. I was a paramedic in New Mexico for 3 years before I started my service as a civilian flight paramedic. And I flew in every corner of the state and everywhere in between. I flew all across the state doing critical care services. And during that time, I recognized that the need for these services are just as important in rural New Mexico as they are in populated centers. Someone in Raton or someone in Silver City gets just as sick as they do in Santa Fe or Albuquerque. So how do we expand those access to services for those individuals while also bringing down costs, because we know that it's very expensive? And then I started working in New Mexico or in Old Mexico with migrants. In a camp in Matamoros, and I thought, man, I really wish I had the resources that I had in New Mexico. And then I went to Sierra Leone, and I said, man, I really wish I had the resources I had in Mexico. And then I moved back to the States here in Santa Fe, and I thought, you know what? The disparities that we're seeing internationally really do impact a large part of the population here at home. And it was a really unique perspective to have, and one that is quite troubling, and one that makes me excited to get up to come to work every day, to work with my team to say, how do we address these issues when so many more people are feeling displaced from the healthcare system? Even those who have insurance can't afford their copay or their deductible. People have incredibly long waiting lists that they have to face for dental care. Many providers don't, take Medicaid for children for dental care. How do we address these things? Because we all deserve to live a healthy, happy life, and all of these services are incredibly important. So it was really refreshing to join a team of doers, from the board of directors to our staff to our supporters, who said, we recognize with you that this is an issue, and here's how we're going to address it. And that's how we've developed our game plan over the last year, and why we're seeing the increase in the impact that we have.
Oh, I love that. All right, we'll be back in a moment with more Conversations Different.
We make renewable doable. We're positive energy solar for a cleaner, brighter future for all. Positive energy's the right call. Feel good about your energy bill. Help save the planet too. Your trusted solar company, working hard for you. Generate positive energy. Positive energy solar.
We're back with Conversations Different and Mark McDonald talking about Villa Therese Catholic Clinic. I want to go back to the idea that you're treating people who otherwise might not have access to care, and you do it without federal grants. It's private donations, private grants. How do you get that money so you can keep going?
That is a mission of ours every day. Nonprofits face this in easy times. How do we keep funding going? How do we keep staff on? Um, Particularly the last 6 months have been increasingly difficult because what we're noticing is, with uncertainty and insecurity from federal funding for a lot of our partners who do rely on federal grants, they're being pushed into the private grant space and private donation space, which makes it that much more competitive. So when you have a littler piece of the pie that everybody's fighting for, it makes it very difficult. One of the things that we do is we are really good at storytelling, and we have quite the story to tell. We focus on what our donors are actually doing in the lives of our patients, and that makes a difference. When people know if I give $25 and it can provide 2 months worth of primary diabetic medication to a patient, they have something tangible that they can relate that $25 to. And it makes a difference when they're making a decision to give. And we recognize, particularly during this time when it's more difficult to fundraise, that everybody's pressed. It's not just grantors. It's not just the government. It's everybody. Everybody's feeling that increased pressure. And so we have to be as transparent as we can be about how our money is used, the money that we're gifted, how it's used, how it's spent, and the impact that it has. And we find that that's really, really important. If you go to our website, villatherese.org, villatherese.org, you can actually look at our 2024 impact report, which talks about all of the services that we were able to provide and how that money was spent on a large scale. And then just making sure that our donors know that they're appreciated, because really it is them who helps us make a difference. It is so important to maintain those relationships with them. And then, of course, with our grantors and our sponsors, we have to, again, make sure that there's that level of transparency, that there's reporting, that if they give us money, that we have benchmarks that we're meeting. And if we're not meeting those, action plans on how we're going to make a bigger impact so that that money is leveraged. Because we're not just charitable organization. That is the core of our mission. But we're also trying to help the healthcare system in general and the taxpayer. Think about it this way. If we serve 10 people in our walk-in clinic that otherwise would have gone to the ER, we're saving the healthcare system, patients, and the taxpayers tens of thousands of dollars if it's something we can treat here that they don't have to go to the ER for. So all of those things make a difference, and it's messaging that and having people understand why the mission is so important. People respond well to that, and that's why we're so grateful for the opportunity to share that message with you today.
Oh, good. And we will share it as widely as possible. I know that tickets are going on sale in July for your October gala, and then people can also donate by going to your website, which you gave. And what other ways do we help?
Absolutely. So the gala is our biggest fundraiser event of the year. Tickets go on sale July 1st. We're going to be so excited to host it at the Inn and Spa Loretto again this year. Last year was a record-breaking year for us. People were excited and engaged. And so please look at our website for more details on the gala. If you are an individual or a business who wants to sponsor the event, we have different levels of sponsorship. Please consider those because they all go towards making that impact for our patients. Other ways that we can use help, of course, if you have it in your budget and you're able to provide a $25, $50, $100,000 donation individually, all of that obviously helps. But there are some really important ways that you can help us even more. And that is, you can help us by volunteering. We need volunteers all of the spectrum. If you're a healthcare provider, we'll plug you in. If you are an admin expert, we'll plug you in. If you're a social media or legal expert, all of those things are needed just like they are in a regular business for a nonprofit, because we are a regular business. So we definitely accept volunteers and we'll plug you in somewhere. So that's one way you can help us. The other way you can help us, tell people about the services that we provide. If you don't know about the services that we provide, contact us, get a hold of us through our website or call us. And we can get you a list of all the services that we provide. Our core mission, again, is to make an impact for those who are uninsured, underinsured, and feel displaced and the most underserved in the healthcare system. And we're not going anywhere. We're here. We're committed. We know that this time is particularly tough. One of the ways that you can help us the most is to let people know who we are, where we are, what we do, and that this is a safe place to come for medical care.
And it sounds like even as you have more demands put upon you because so many people need medical care, you're ambitious. You're trying to start a mobile clinic and also increase capacity. And that's like in the next 12 months or so. So how are you going to accomplish that?
Well, with a lot of faith, we know that there are a lot of people who support the ideas that we have to expand the care that we need, and we've proven the case that it's needed. It's not just some, hypothetical. It's a real life scenario that we're facing. If we take a look beyond just Santa Fe County, the city of Santa Fe, we look at Rio Arriba County, Taos County, up in Los Lunas, Clayton, Raton, all of these areas, and southern New Mexico too. If you look at all of these areas, the need is there just as much as it is here. So our goals are ambitious. Yes, we are proposing to launch a mobile clinic, which would help address outlying communities and communities who can't get to us. We talked about that earlier, transportation issues to our clinic. How do we get to the patient so that we can serve them? Because one thing that we know is that if we can intervene on a lot of these chronic conditions like diabetes and high blood pressure, if we go to the patient, we're able to provide that point of care testing, same day results, and same day interventions for these chronic diseases, we're saving the patient a lot of money. We're saving the healthcare system a lot of money. But more importantly, what we're doing is we're actually increasing health outcomes. We're making sure that they have lowered risk of heart disease, lower risk of eye disease, lower risk of mortality if we're going out and taking a preventative approach to a lot of these issues. And so, yes, our goals are ambitious, but we are gaining a lot of support and traction because we've done the work. My team has done the work. We've looked at NIH studies. We looked at community health needs assessments in the state. We've looked at partners that we can help staff this. We've looked at diversified funding models. We have literally a 40-page plus document that talks about how people can understand our mission with the mobile clinic initiative and how it's an extension of what we're already doing. What's it going to bring as far as an expanded impact to the work that's already being done here?
That makes so much sense, especially if the government goes ahead, the federal government passes the so-called big, beautiful bill and cuts access to Medicaid, because then they're going to have a lot of people falling off the healthcare rolls and they're going to be, more of a need for services. So you guys could be pushed, in terms of capacity even more.
We're already seeing that. I mean, even just the idea that that's possible. People are saying, how do I prepare for this? How do I plan for this? If I know that my coverage is going to be lost, whether it's private or whether it's Medicaid, how do I prepare for this? Because one of the things that we have messaged that we know to be true is continuity of care saves money. And it's not all about money. It's always about patient outcomes. But we also have to have the conversation in this time about how do we save money? Continuity of care is important. Come, let us be your medical home. We'll start that continuity of care so that if that, God forbid, happens that you lose your coverage, we're your home and we'll help you navigate those difficult times.
Yeah. And it seems like it doesn't just save money, it helps people be able to if you trust your doctor, if you know your doctor, you can tell them things that you don't tell other people, and the doctor will notice if you're sicker or if something's happening to you that's not normal. And we lose that today.
Absolutely. Absolutely. That is every time we bring on a provider or our existing providers, we talk about that. How do we make our patients know that this is a safe place? We have a compassionate, no questions asked policy, which means that, yes, we do have a target demographic of uninsured and underinsured individuals, those who are most at need. But if you walk into our clinic, we don't ask you any questions. We don't ask you if you're employed. We don't ask you your insurance status. We don't ask you your immigration status. So we are collecting data a lot in a blind manner so that we know what our patients' needs are, but we can't attribute it to a specific patient unless they, relay that to us confidentially. That allows for the patients to feel comfortable, to know that their issues are going to be assessed and addressed, but also know that they have a lot of security in their medical home.
That makes sense. I've always thought that if the government took this approach to how it hands out, grants or welfare or food stamps and just said, if you need it, come, they would save all the time and money with the paperwork. And I just don't believe that many people would go lie to steal, from them. It just seems like some more efficient way to operate.
We find that to be true. And again, part of our core philosophy is even if you have private health insurance, if you're coming to us, something drove you here. There's a reason why you sought out our help, and we're committed to help you navigate that. Now, we do have conversations with patients if they're willing to divulge that they have insurance. We help them navigate areas where they may get more comprehensive care that is covered by their insurance. Sure, we have those conversations, but we also recognize if somebody walks through our door, something drove them here, something made them seek our services, and we are going to meet them where they're at and start from where they're at and help them navigate the circumstances.
Okay. On that note, we'll be back in a moment with more Conversations Different.
This is Patrick Dorsey, publisher of the Santa Fe New Mexican. Looking to reach a wider audience and grow your business? For 175 years, the Santa Fe New Mexican has been the trusted voice of Santa Fe, with unmatched local reach in print and online. In addition to our long-standing, independent, family-owned newspaper, we have a full-fledged marketing team with the expertise to help you succeed in the 21st century. From traditional print to precision-targeted digital advertising, we have the tools to connect you with your ideal customers. Partner with us and see the results for yourself. Advertise with the Santa Fe New Mexican and unlock your business's full potential. Visit us at santaFeNewMexican.com/advertising or call us at 505-995-3852. Thank you.
We are back with Conversations Different and Mark McDonald talking about the Villa Therese Catholic Clinic. For 1 second, let's focus on the Catholic part. So when you talk about no questions, one of the questions you don't ask is, are you a Catholic? It's everyone goes to Villa Therese.
Absolutely. Everyone is welcome. Everyone's welcome to volunteer. Everyone's welcome to apply for employment. Everyone's welcome as a patient. Everyone's welcome to help us spread the word of our mission. We have deep roots in the Archdiocese of Santa Fe. As you mentioned earlier, we were founded by Archbishop Gherkin and the Sisters of Loretto back in 1937. And we really honor and cherish the work that the Catholic Church and the Archdiocese has done to make a positive impact on the lives of New Mexicans. And that is our goal. We come to work every day with the mission of who can we help, and it doesn't matter. There's no pre-qualifications or excluding qualifications. It's everybody who walks through our door. We don't ask questions. We just try to figure out how to help you. If you look at the root word of Catholic as well, lowercase c, it means all-inclusive. I mean, that is the definition of lowercase Catholic. And so, yeah, absolutely, universal, all-inclusive, and that is our mission. Yep.
Yeah. I think one of the things that people forget, maybe who come here recently, is that for many decades, for centuries even, the Catholic Church provided the teachers, the healthcare workers, and really kind of laid the foundation for taking care of people in the Southwest.
Yeah, absolutely. One of my favorite books that I read when I moved back to New Mexico from Old Mexico was Death Comes for the Archbishop. And I read that, of course, in high school. I grew up in New Mexico, so it was a requirement. And then I got interested into reading the actual biography of Archbishop Lamy, which was Lamy of Santa Fe. And it was an incredible, incredible history and retelling of kind of how the roots of, the church, the diocese, and eventually the archdiocese took hold in New Mexico and really made a positive impact for so many. And we focus on the positive part of that story and say, how can we carry that mission out to impact and provide services to the most amount of people, not just in Santa Fe, but statewide that we can.
Right. And it's really part of Catholic social teaching, which in the United States, which is so focused on culture war issues, that I think sometimes Catholics themselves forget that one of the tasks that Catholics are told to go out is to take care of each other. So this is faith in action, really.
Absolutely. Absolutely. And we're surrounded by so many great members of the Archdiocese, of so many local parishes, and of other faiths who have joined us to make this possible. And so we're so grateful for that, and just to give a little bit more comprehensive perspective on how serious we take that. I'm the executive director of this organization, and I'm not Catholic, and we have made a home here. They have welcomed me. They have made sure that I have every tool possible to help expand this mission. And it just really speaks to what the ideology, what the mindset is around people of faith, regardless of what faith, reaching out to those who are most in need and making the biggest impact. And we love to see it.
Yeah, that's just incredible. And think about the ease of mind for a parent who needs to get a preschool physical so that their kid can actually get into school, play on a sports team, and they can't get it anywhere. They don't have $300 to pay for it, and they can call Villa Therese to get an appointment
for free. Yep. We have providers who are dedicating right now. We have July 15th and July 26th dedicated to child welfare screenings, preschool screenings, sports physicals, vaccines for children to get them back and prepared for school. We'll also be providing them with backpacks stocked with supplies so that we are not only focusing on health, but we're partnering with other agencies to address the social determinants of health, education, food insecurity, housing, all of those things that impact someone's health. We're partnering and creating those partnerships so that we can address those things as well. And yeah, this is the home. This is the place to do it because, there's no exclusions. Everybody's welcome. We recognize the importance, and we will help you navigate how to figure all that out, because sometimes it's difficult. A lot of times it's difficult.
No, it is. And sometimes you're so busy just trying to get to work and, put dinner on the table that the things for school or to get you ready for the world just fall between the cracks.
Well, not only that, you're absolutely right, Inez, and not only that, but we try to take a look at how healthcare and the little tiny services that we can provide make a huge impact. For example, we started recently doing lab drawing blood for lab results in our office. Some people say, well, can't they draw that at the lab that you partner with to run the labs? Yeah, we can. But there's a draw fee, and sometimes those draw fees are minimal, like $7. And I roll my eyes and say $7, but then I think that $7 sometimes means dinner for family or not. And so if we can say, we'll draw the blood here for you so you don't have to worry about that $7, keep it to put food on the table or to buy your children a notebook for their class the next day, those things make a difference. And it's those small details that our team is committed to addressing to make sure that healthcare isn't a barrier to other aspects of life, and at the same time tearing down the barriers to healthcare.
No, and if you are, let's say, dependent on your neighbor for a ride, if you only need a ride to the doctor's office and not a ride to the lab, there's just 100% more likelihood that you're going to get what you need and you're going to get the test that will say you're sick or you're not sick.
Absolutely. It's that continuity of care. We can also assure that the patient gets their blood work done. They don't have to fear, particularly for our friends who feel unsafe going into public right now because of whatever circumstances, maybe their unknown immigration. They have a hard time coming here. So sending them somewhere else, we may not ever get those blood results done. And it's really critical to their health. And so those little services that we provide just go above and beyond to make sure that those patients have a safe home, comprehensive health care, and that we're helping them in every single way that we can.
Yeah, that's really important. I mean, I have health insurance. At getting to the right lab that actually took my insurance turned out...
It's difficult.
Yeah, because they switched labs on us and didn't tell us. And I ended up with a $300 blood care bill that I had to pay. And I was like, okay, I'll be more careful next time. But it's just way too many complications. And if you're stressed because you have 2 or 3 jobs or you have, 4 kids that are little, it's just really hard.
Well, look, we know that medical debt is the #1 reason for bankruptcy in the United States.
Yep.
That is 100% unacceptable. So you imagine you have a middle-aged woman who comes into our clinic and she's worried that she may have diabetes. If we refer her to a lab, she doesn't know which lab to go to. She ends up getting a $300. She finally figures out what lab to go to. She gets a $300 bill for her hemoglobin A1C test and all the other tests that we requested to run. Now she goes home, she gets the bill. She's been diagnosed with diabetes. She can't afford her lab draw bill, much less the medications that we've prescribed her. Now she's got stress, which raises cortisol on top of diabetes. It compounds. And she's worried about that $300. Well, now I've got to get my car fixed so I can actually make it to work. That's too much. It's too much for our friends, our neighbors, our family. And so we're committed to addressing all those little things that we can to make a difference, because we know the real life implications. And it's not just stress. Sometimes it's life. Sometimes it costs our patients their lives if they don't get these things addressed. So we're committed to helping them in every way that we can.
No, that's so important. I mean, we're hearing stories now, and they're going to only get bigger as people who could afford their EpiPen, or the albuterol was switched and it's now more expensive, and they die. I mean, people are dying in the United States because they don't have the medicine they need, or they can't see a doctor when they need to.
Yeah, absolutely. That's why we're also, if you don't mind me just saying, we launched a new campaign just in the last couple of days called Dose of Hope. It's focused on letting our donors know exactly what they donate. $100, it'll provide antibiotics for 10 patients in our walk-in clinic, because it's nice to come to our free clinic and know, hey, we recognize that you have diabetes or high blood pressure, but what are we doing to help support and treat those chronic diseases? And we have a wonderful partner in town that we work with to help us provide patients the medication that they need, and we cover the cost so that our patients make sure that they have those medications until they have an alternative game plan. We're also so grateful for such a giving community who gives us gift cards that we can give to our patients to say, your prescription's only going to be $5 at Walmart with our discount card, and sometimes again that $5 makes a huge difference in their lives. So we'll provide them with funds to help cover that prescription cost in a way that is, of course, in line with our mission and in line with nonprofit laws, which can get tricky, and also just making sure that those patients have the assistance that they need to follow through with the treatment for the diagnosis we provide them.
Yeah, that what I like and what I hear from you is that you really understand where people are, not where we think they should be. You don't have a work requirement to go get treated at Villa Therese. You just say, here's the help you need. And how many lives are you saying are improving? That's huge.
Yeah, well, to bring up the numbers and to let your viewers know, we've already maxed out the total number of patients that we saw all of last year. We've already surpassed that number this year, and that goes for our medical and vision clinics. Our dental clinic is up 142% in volume. And these are patients who are truly in need. And we know that there are patients who are in the south side of Santa Fe, the north side of Santa Fe, our neighboring pueblos. There are patients in Espanola and all those areas that aren't getting to us that say, man, I wish I could make it to Villa Therese. And my job behind this desk with my team is to say, I hear you. How are we getting to you? For example, we are going to Clayton, New Mexico on July 8th to do a free eye clinic. We went to Raton last year. Raton has no eye care, no eye clinic whatsoever. The Lions Club there was providing free glasses, as the Lion Club does. It's so great. It's such a great service that they provide. But they have to have a current prescription. Well, no one in Raton who needed a new pair of eyeglasses had a current prescription because there's no doctor there. So they would either have to travel hours to go get to see an eye doctor, or on a wait list for a very long time. So we went, gave them current prescriptions with their eye readings and basic free eye exams, and then they were able to get glasses from their local Lions Club. So those little things also make an impact, because we know that this isn't just a Santa Fe issue. This is a statewide issue. And we're, part of our mission is looking at how we can expand the services of Villa Therese to all of the state. That doesn't mean us expanding directly, but how can we partner with other nonprofits in the state to teach them how to do the work that we're doing so the impact grows? Capacity building.
And that is a great note on which to say this has been another Conversations Different. We'll be back next week. Thank you for listening to Conversations Different, hosted by me, Inez Russell Gomez, editorial page editor for the Santa Fe New Mexican. Our weekly episodes would not be possible without your support. We hope you enjoy them and keep listening. New episodes drop every Tuesday. Consider signing up for our newsletter so you never miss an episode, and while you're at it, consider subscribing to the Santa Fe New Mexican. Our podcast is available by visiting our website, santafenewmexican.com/podcasts, or wherever you get your podcasts. Conversations Different with Inez Russell Gomez is produced by Matt Dalside and Ernesto Cisneros, published by the Santa Fe New Mexican, a local and independent newspaper owned by Robin Martin.